There we go. Okay. Okay, I'm just gonna pull up my slides. Oh, 1 second. There we go. There we go. Okay. Sorry, I'm a little discombobulated. I was just out on an appointment and someone had to get hauled off in an ambulance. So I'm like running late and just a little disorganized. Okay, here we go, however. So thanks again for being here. If you haven't met me, my name is Bridget Danner, and I'm an acupuncturist here in Arizona. I'm also a functional health coach working online. I have some specialty around mold, but just generally around functional medicine too, which definitely includes gut health. And I'm about to tell my story in a minute. I also someone who had IBS for many years, and now I do not. So I wanted to share that story as an example. But today we'll talk about how digestion happens from the top to the bottom, so to speak. And, if digestion is running smoothly, it's, all pretty simple. Food gets broken down and fluids get separated out and things go pretty smoothly. But there's definitely quite a bit that can go wrong. And the tricky thing with IBS is that there's so many reasons that you could have it. Sometimes you have more than one reason. So it can be, missed or misunderstood for many years. And in the Western medical community, there's certain things that they may be very good at identifying or treating. And then there's things that they just aren't as good at identifying and treating. So that's really where Chinese medicine, functional medicine can be helpful. So this is just educational. I definitely encourage you to have a practitioner, a team of practitioners you work with one-on-one. So a little bit about my own IBS story. I actually started to have some digestive issues in junior high. I had an ulcer. I was having like heartburn and like drinking milk all the time. I think I actually had a duodenal ulcer, which is part of the small intestine. And it was probably I don't know if I mean, most like stomach ulcers are H. pylori. I don't know the origin of mine. I was young. I just had like conventional treatment. But just interesting, to think back on. But then I think it resolved, so to speak, and I didn't have any more issues that I remember for quite a while until when I was in my early 20s after college. I lived in this country here, which is Guyana in South America. I lived in a very rural area. It's a little bit like the picture on the right. Uh, there is no water filtration, for example. So we had a basic filtration system that seemed to work, but I was exposed to a lot of new bugs that my body wasn't used to. And over the course of the year I lived there, I had, I don't know how many incidents, maybe we'll say 4 incidents where I got really sick with a very high fever, severe diarrhea, and no treatment options whatsoever. Just writing it out. So I really think that experience, and we'll see that come up in the presentation, threw off my gut. And I came back to the US and then actually lived in Mexico for a bit. And I was having a lot of constipation there. I never had constipation, but I was really constipated. And then something flipped, and I started to have like a loose stool pattern that lasted for many years, probably like, I don't know, 8 or 10 years without understanding it. So these IBS patterns can last a really long time if you're not addressing them. Some people are really going their whole lifetime with it. And then some of you may know I had a big experience with living in a moldy home. This was me during those days. I was really puffy, my eye was twitching, and my digestion um, got, I would say it worsened, but at the same time, my dietary habits got way better around that time. So I think around the same time I moved in that house, I also cut out gluten, cut out dairy. I was cooking my own food all the time. I was eating a salad every day. So I was getting, I was eating cooked food too, but I was getting just a lot of nutrition. So I think that really helped me out during this period I had mold. But I was becoming like increasingly food sensitive. And then I just had the whole pile of other symptoms happening from the mold that I didn't know about for quite a while. So anytime there's chronic mold exposure, the gut's pretty much going to get dysregulated in that process, which we'll talk more about. These are some pictures of me more recently. I don't have IBS at all. Um, I just don't, and I can talk about what worked for me and what I found. So things can definitely be, reversed. And that's the good news. This is Dr. Constance here, if you know her from our Scottsdale practice. And this is being a friend of mine who's just in town. So, from being extremely fatigued and immune depressed from toxic mold, from being diagnosed with H. pylori, parasites, candida, gut infections, like it's all gone, it's all reversed. So it's totally possible. Okay, so digging in, what is IBS exactly? So it's actually a syndrome, irritable bowel syndrome, and a syndrome in Western medicine is a group of symptoms without a known cause. So right off the bat, they're going to say we don't know the cause. There are 3 types, which you can see here. Actually, constipation and diarrhea can be both from the same origin of like a dysbiotic gut. So sometimes you see a body go from loose to constipated, loose to constipated. That's the mixed type. And IBS can also involve cramping, bloating, urgency, feeling like an incomplete ability to move your bowels. And I read somewhere, I forgot to write down the source, but it's estimated up to 15% of Americans are experiencing IBS, but only maybe up to half of those even seek treatment. So a lot of people are just sort of living with it, saying, this is how I am now. And I think to some extent, I was like that for a while. I didn't really know what was causing my IBS. I couldn't really figure out what the foods were that bothered me. I did have a lot of improvement just with diet, but ultimately, I think it's most effective to do different protocols to get to the root cause. So this is how digestion happens. Really starts in your head from your brain and your mouth. Your brain is a big part of signaling correct digestion and getting feedback also from your gut. Your hormones are involved in some processes that stimulate digestion. You're producing saliva, you're chewing, and then as food passes through, it's getting just broken down, absorbed, ultimately kind of fermented and separated in the large intestine. And then evacuation is important too. And we need to be having a bowel movement at least once a day to be properly, evacuating our bowels. So on the left here is a picture you may think of, more when you think of the digestive system. You think of, the stomach and this big mess of intestines in the middle. But on the right here is a nice graphic about also the brain gut connection. It includes a little image of the vagus nerve and how it's um, going from the brain through the organs, and information is going back and forth. So, this picture on the right shows some what they're calling inflammatory triggers and getting a resulting intestinal inflammation and permeability, which then is becoming systemic inflammation that can then also become neuroinflammation and then even neurodegeneration. So it really does matter how we take care of our gut because of these potential, side effects, so to speak. And then if the brain is inflamed, it's not going to control the gut activity correctly either. So the brain itself can have injuries like TBI, traumatic brain injury, that affect digestion and that you may not really realize can be a factor, but it can be a very sudden and impactful factor on your gut health. So it's really important to take concussions really seriously so you don't get lingering symptoms. The brain, of course, like houses some of the hormone control centers of the body, and hormones have an effect in stimulating digestive secretions and that kind of a thing, the motility. So it is actually important to have your hormones in balance, or more or less in balance, for proper digestive function. So this is a nice graphic kind of showing, again, some of that two-way communication between the brain and the gut, and a little bit about, hormones and how they're affected. The gut is making um, short chain fatty acids that benefit the brain. It's actually producing neurotransmitters that are going to affect your mood. So, again, gut health being really important. So, also, the brain can be affected by what we put into the body or what we're exposed to, whether that's living in toxic mold, eating food that has antibiotics or additives, being exposed to infections that the immune system becomes overwhelmed by. So, that can, in turn affect the gut and the brain. I just wanted to give a little bit of a page about hormones. We won't go too deep into hormones today, but if you're in high cortisol or chronic stress, that can negatively affect digestion. Could be more diarrhea or indigestion, or could be constipation. Thyroid is kind of a stimulating metabolic hormone, so if that's low, you can also get into constipation. A little more rarely, you can get into like autoimmune hyperthyroid, and then things could be moving too quickly. As you go through perimenopause and have a decline of estrogen and progesterone, that can affect digestion. And even month to month, as your hormones shift and you have like PMS, that can affect digestion, which you may have noticed already. So could be constipation, loose stool, or just feeling full, feeling bloated. And then we're moving on to the mouth. So in the mouth is where, excuse me, you're chewing, obviously, and you want to chew your food well. You want to eat on the run, or not eat on the run. You want to eat in a relaxed environment, which we don't always do, right, in this culture, but it's really more ideal. Um, you want to be able to smell food, which a healthy brain can do, but an unhealthy brain may not be able to do. Smelling activates some digestion. Some medications can reduce your production of saliva, so you're not breaking down food. So that could be something to check if you're taking different medications. You can also kind of flood your digestive system by drinking fluids at mealtime. In Chinese medicine, they don't really drink fluids with meals. Well, not much anyway. Culture kind of changes over time. But if you go to a restaurant in China, or at least when I was there, they don't give you a glass of water. They give you your food. So just, maybe making that change is just one change you can make to benefit digestion. Eating more slowly, putting your fork down between bites, chewing well, not drinking fluids, and really eating at home where you can smell food cooking. Actually, you know how you smell food cooking and you get hungry. It's because it's stimulating digestion. So eating at home, home cooking is really good. I just wanted to pause and say, as we go through this, you don't have to memorize everything you're hearing, but just try to, store away a few things that might be relevant to your own case. So if you are eating on the run, if you are maybe on some medications and you're having dry mouth, like just just note for yourself what in this presentation may be relevant for you, right? So you can maybe go back to your provider and say, "Hey, I kind of want to check my thyroid," or, "Can I run a test for gut infections?" Or just, change some of your habits. So, don't want you to be overwhelmed, but I'm just going to cover a lot so that you can find in it what you need. Okay, after chewing, things move on to the stomach, which is churning food plus also releasing a lot of really strong fluids to break down food. And then it controls the rate of food getting into the small intestine. So, as we age, or if is some kind of, again, like brain issue, if there's an infection in the stomach, sometimes stomach acid levels are low, and that is a harm in digesting food, but also in warding off infections. So that hot acid in the stomach is meant to kind of kill infections too. So one thing you can potentially look at, especially if you're having heartburn or you're getting older, or if you've been told you have H. pylori, is working on eliminating H. pylori and increasing stomach acid, which you can do with a supplement, but also could potentially be benefited by, working with the brain or what other issues are going on for you. So here's a little quotes from an article about H. pylori. And, a lot of us have H. pylori infection, but not all of us are symptomatic. But they're basically saying that, like, if you are symptomatic, you do have IBS, the H. pylori treatment can be helpful. So it's worth treating. So saying how H. pylori can create chronic infection, um, nerve remodeling. So nerve remodeling with IBS is not a good thing. It's like the nerves of the gut becoming kind of overstimulated, and then you're getting more pain and cramping. So we test for H. pylori in a stool test, and there's probably some other ways to test too, like a breath test, or I don't know what they do in a conventional, like, Western clinic. But H. pylori can be treated with antibiotics, or it can be treated with herbals. Sometimes you need to recheck if you're using herbals to treat it. But if H. pylori is present, stomach acid is usually low, so you're getting like a double whammy of this infection and inflammation plus a lack of digestion right from the start at the stomach. So other infections can happen too that stimulate IBS, and I don't think this is talked about enough. And they're calling it PI-IBS, so post-infectious IBS, and it's at up to 30% of all IBS cases are this PI-IBS. So I think this is kind of what happened to me with living in South America. Is I definitely got infections. I don't even know which ones, and then my digestion really changed. And here it's saying about a third of people who have an infection will go on to develop this post-infectious IBS. So that's really high. Um, not all of them will, but if you develop it, they're saying it can go on for months or years. And here on the bottom, it's saying, if you're from a Western country visiting developing nations, you are vulnerable to this. And that's kind of what happened in my category. although you definitely don't have to leave the country to be getting a bad infection suddenly. It also can just be from, foodborne, from any food really that you're eating could have infection on it. Can be from like camping and just eating contaminated or drinking contaminated water. So I think this is a really important one as you think about your own case. Did you get a stomach bug? Did you get really sick? And then you never really recovered. You're never the same. Moving on to the small intestine. Uh, Very important area for nutrient absorption. So when you're thinking of getting nutrients out of your food, it's mostly happening in the small intestine. It's not meant to be an area that has much of any bacteria or fungus. That's more the large intestine. But again, if there's been an infection or some kind of upset, there can be potentially overgrowth of bacteria or fungus in the large intestine that can cause a lot of bloating. So just these are just a few of the functions that happen in the small intestine. A lot of digestive juices are being released by other organs into the small intestine, including bile. And there's a hormonal process that's happening to signal this to happen. Um, Again, here you see a little bit about like the nervous system being involved, and that can be overstimulated with, infection, and then you can become just really irritated. Or you can go the other way and not have enough nerve activity and then not have this. In the second paragraph, you'll see this peristalsis is the name of what keeps food moving along the tract. So if you're not having any gurgling, if things are just kind of stuck, then and then let's say you have some overgrowth of bacteria in the small intestine too, you're going to get really bloated. Uh, so the food is supposed to spend about 5 hours in the small intestine, which I thought was interesting. It isn't that long, it should be moving on out. It shouldn't be stagnating. There's also a mucosal um, wall in the small intestine and the large intestine, and that's a really important area where the body is both having immune activity and there's absorption happening. So we'll talk more about that mucosal layer in a bit. So some of the issues that can happen in the small intestine, ulcers, like I think I had when I was in junior high. Celiac disease and Crohn's disease are autoimmune diseases of the gut, the first one relating more to eating gluten. But just that whole small intestine become inflamed, again, it could be from an infection in the past. There can be other issues with like lack of blood flow to the area. Some of these, again, are maybe a little more out of the bounds of functional medicine. And some of them are really good cases for functional medicine just because we're good at identifying infections and treating infections and inflammation and that kind of a thing. So large intestine is a place where fluids are sort of separated back out, nutrients not as much absorbed, but some absorption. And this is where some of the fermenting happens with bacteria that's in the large intestine. And that is a really important part of digestion and health, is having a good variety and good quantity of healthy bacteria, friendly bacteria in your large intestine. Now, all of us are going to have a little bit of unfriendly bacteria or yeast, but it's really more about the quantity. So you want the friendlies to be dominating and the unfriendlies to be kept in check. So I feel like the microbiome is an area that's become very much explored in modern life, which is great. But it's certainly not the only part of digestion, right? We've talked about all these other processes before we got to the large intestine. But we will talk a little bit more about the bacteria here in a minute. So some things that can happen in the large intestine are colitis, and then, oops, I have a typo here, um, hemorrhoids, rectal prolapse, cancers, and then pelvic floor dysfunction, I think is interesting. I have a slide coming up about it. Just sort of losing the muscular ability to um, kind of push out stool. So this could be a good one to see a Western practitioner for and get biofeedback type treatment, physical therapy treatment on the pelvic floor. So this pelvic floor dysfunction may happen from having a hysterectomy, having childbirth, or difficult deliveries, just straining to go to the bathroom for too long, aging. So this is, I think, a good one to consider if you're just like kind of can't push anything out. And that may also translate to difficulty urinating. Here's a little more information on the gut microbiome and that large intestine. So, especially they're breaking down fibers, and they're breaking down some mucus as well. This area being healthy can prevent colon cancer, can encourage glucose absorption for energy, can prevent dysbiosis when this process is happening correctly. And dysbiosis is just an imbalance of bacteria. Something that's getting produced by these bacteria are short chain fatty acids, which do a lot of good things in the body, actually help us make healthy fats for hormone production. So that's important. Can help prevent obesity, reduce insulin resistance type patterns. Short chain fatty acids also positively feed the brain for brain health. So those are some reasons, why it's so important to have a healthy microbiome. I could talk about this for a long time, but if you've been chronically exposed to toxic mold, it can have a strong effect on gut health in many ways. There's probably more ways than this, but can contribute to leaky gut and leaky brain. And leaky brain makes an inflamed brain, which can further affect your digestion, plus your ability to think and function. An inflamed brain is just not going to control the body correctly. Many people who have been exposed to mold develop a thyroid disorder, either just a low thyroid or autoimmune, and then that can affect your digestion. Mold can increase histamines, and then you're feeling more sensitive to histamine containing foods, or you're not breaking down histamines well because of poor gut health. And so having those high histamines can mean anxiety, allergies, skin issues, headaches, that type of thing, racing heart. It can decrease your levels of sex hormones, which can have a negative impact on your gut. And it very much suppresses the immune system, which makes these gut infections much more able to thrive. So it's lowering friendly bacteria, it's creating inflammation, and then it's letting these infections really thrive in your gut or even other areas of your body. So it's just really common to see gut imbalance, whether you have a lot of gut symptoms or not. You've probably got some issues going on in the gut. And then Chinese medicine in the gut, really kind of looks at things from a different lens, but the main system that's associated with digestion is called the spleen system. And it's basically is making energy from food. So that is a similar explanation. Something that's really interesting that you may relate to is the spleen organ is associated with overthinking or worry, and saying that worry damages, the ability of your spleen to function. And I think many of us who have digestive issues can relate to being kind of a worried person, overthinking, not as easygoing, and then, having a touchy digestion. The spleen can also be attacked, so to speak, by the liver when we feel angry or frustrated. So you may have experienced that. And also, PMS is like a liver stagnation that can be overacting on the spleen. Some other symptoms that may go with spleen deficiency are fatigue, a pale, puffy tongue. So over on the left is kind of a historical looking picture of the spleen channel, which kind of runs up your inner leg. So again, we could talk a lot more about this aspect, but at least that's a little introduction. Okay, moving into what to do about it. So hopefully you got a sampling of there's a lot of potential causes, and you may have more than one. You may have 3 or even 5 of those causes, or you may just have one if you're lucky. Uh, and there's different practitioners you can see to run tests, to be treated. Again, try to think about your own case and what you may need in particular. So here are some of the questions you could ask yourself for self-assessment. So, are you experiencing chronic stress? When your IBS came on, was it quick or slow? Was there a trauma that happened before it? I'll give you an example on this one. I had actually 2 different clients I can think of had a death of someone close to them, and that they went from normal digestion to really bad IBS. And on testing, they're showing infections, but it was also kind of that event that shook the body and allowed for that imbalance to start. And then we talked about, did you say get the stomach flu on a trip and then IBS started? That's a good question to ask yourself that may be related to infection. If you're going through menopause or you're menstruating, how is that showing up with your digestion? Do you suspect or at all if you've ever been exposed to water damage in a humid environment, in an older building? And, just trying to think back is helpful. Did things start after, you had antibiotics or some other treatment? Do you get more and more bloated all day? Is it very severe? What foods do you notice? What medications do you take? Have you had a head injury? Do you have heartburn? Do you feel more like stuck in the upper stomach? So you can kind of get a sense of sometimes where things are happening based on the symptom. Did something get worse after pregnancy? Could you possibly be dealing with a thyroid condition? So some of the other symptoms may be sweating if things are more hyperthyroid, but more often feeling cold, gaining weight, hair falling out, eyebrows falling out, fatigue. In a something like the thyroid, it's not like you'll have necessarily every textbook symptom, but you may just have a few that are really popping out for you, like, just fatigue and constipation. Are you in pain? So is there maybe like a nerve issue? Are you having any blood in the stool? How about trauma? Have you looked at trauma from your childhood or your adult life? What are your eating habits? Have you had surgeries that created possibly, blocks and scarring in the abdomen? And always good to just evaluate, are you doing the basics, the important basics? So also, do you allow time to have a bowel movement? Are you, especially in the morning is a good time. Maybe you drink a big glass of water first, or maybe you go to the bathroom right away, but you allow some time to have it be like in your routine. But also, just good hygiene as far as getting a good night's sleep, taking breaks and getting rest. Uh, just keeping your stress down by having, healthy people in your life and healthy relationships. And as far as diet, you may at the moment be on a more restrictive diet, but ultimately you want a diet with a lot of variety, a lot of fibers, a lot of colors, and then resulting like those colors are usually correlating with antioxidants. So fibers and antioxidants are really good for the gut microbiome. They like that a lot. As far as treatment options, these are some ways that Chinese medicine supports digestion. Chinese medicine can be really help movement, so that could help for constipation. It can help move lymph. There's a lot of lymph in the gut. It's very calming for that. How we talked about the worrying and the frustration. Can help for hormone balance. Functional medicine, may or may not always involve testing, but we offer some ways you can just order yourself online tests. And then functional medicine, may give you like a protocol of supplements, but also potentially diet and lifestyle changes. So there's a few products I really love. I guess there's 4 products, and I'll mention them a couple times. But if you don't have testing, these 4 products or 3 products, depending on your case, can really shift your gut. And I would say that this product, Mega IgG 2000, is the one product that really turned my own loose stool pattern around, like, quickly. Like, I couldn't believe it, after many years. So the sort of more official protocol from the manufacturer is to start with this Megaspore biotic, which is feeding those friendly bacteria and actually starving unfriendly bacteria. So that's just rebuilding that population and, kind of growing it back and kind of building that foundation. And then the Mega Pre is a fiber. We talked about fiber being important. Most of us are drastically not getting enough fiber. So this is a fiber that's specifically designed to feed friendly bacteria. It's not meant to aggravate SIBO, but it is a new fiber. So you always have to add it slowly because it still can feel like a little bloating if you were to add suddenly this whole big dose of fiber at once. So usually you take Megaspore for a whole month, and that you have to start slowly too because it's strong. Then you add Mega Pre, and then you would add either the the Mega Mucosa or the Mega IgG, depending. However, you can kind of do things in a different order. Like if I have a client who is just super constipated, I'm going to add some things for constipation right out the gate. So I may add Mega Mucosa earlier in the process. And the Mega IgG is really great for infections and loose stool. And sometimes I'll give both of those because the person, maybe by testing, I can see their mucosal layer has really been reduced. That's really common. Plus, I'm seeing they have infections. So those products can be potentially both used or one or the other. So I'll go over that a little bit more later, but these are just some of my favorites. I've seen such great results with them. They're a little expensive, but often you can use them even without testing, which is even more expensive, and see really great results. So a few tips on things you could do your own. I've been talking to my local clients here about doing castor oil packs. Can be really great for removing toxins, so to speak, increases glutathione antioxidant, could soften any scars on the abdomen that could be blocking things, can help for constipation and help for depression and mood as well. So this is just a sticky oil that you put on your belly. And this is a pack that was designed by actually a colleague friend of mine. That's just a cleaner way to do these castor oil packs. Whoops. Uh-oh. Hold on, I gotta switch. This is like the wrong slide deck. That was like an older slide deck that I hadn't finished. Okay. 1 second. Let's see. Okay, here we go. Okay, another thing I've been using on some of my local clients is a digestive essential oil. This is a blend, but you can also buy individual oils and make your own. And I described some of the properties of a few different oils, potentially for IBS. So, and you can do these with a tea as well. You can have ginger tea or peppermint tea. But we can get fatigued of taking pills. So you can use this as a little massage on your abdomen with a heat pack or even with your castor oil pack. I usually put some essential oils with my castor oil pack. Just to highlight a few symptoms, because you might be like, well, I have this, and you didn't explain that enough. Bloating, I know, is really frustrating. It's often because there's dysbiosis, that imbalance of bacteria, and there's gas production, which is making you feel full. You're full of gas, basically. So often this needs antibiotic type protocol to kill off unfriendly bacteria, and then also building that friendly bacteria so it can dominate and building up that gut mucosa again. So those are kind of three elements that you will usually help. Dietarily, this diet can really help you with bloating, and it's not meant to be forever. So these restrictive diets are just short term to give your body a little break because you're already very irritated. You're having bloating, you're having pain, you're having cramping. So this diet's called the low FODMAP diet, and FODMAP stands for a group of fibers, basically, that that are fermented. So if you take these out, your body won't have to ferment them to break them down. So you're having less gas. It can give your body a break. I think it's good to do for minimum 1 month, and then you can start adding those foods back in, ideally one by one. And you may find that there's just a few of them that make you feel more bloated, and you stay off those maybe a little longer. So this woman, Kate Scarlotta, has some really nice checklists for FODMAP foods, and I would suggest just go and print those out and take them to the grocery store. So just see what you can eat and what you can't eat. And it's not that hard, right? And it's not forever, but it can take a little pressure off your system. And I kind of talked about this already, but ideally, really your goal is to eat a wide variety of healthy foods. So if you've got a practitioner telling you, well, I want you to stay on this anti-candida diet or this FODMAP diet or whatever, like indefinitely, it's not supposed to be an indefinite thing. It's supposed to be a temporary thing while you work on the root issues. Okay. So, and I'm often asking my clients to add a little more food. And I'll say, okay, it doesn't have to be, a lot or some, French fries or something, but, start adding, rooibos tea, or you start cooking with like fresh rosemary, or have a tiny bit of, I don't know, kimchi or something if you can tolerate it. Like, be adding more food little by little, because that's going to feed more bacteria. If you have a restricted diet, you're going to have restricted bacteria too. And then you try to add a food suddenly and you get completely thrown off. So the more variety of foods you have, the more you can handle, right? Then you can have a certain salad at a restaurant or beans or whatever, and your body's like, oh, okay, we know how to process these because she eats a variety of foods. If you eat a narrow amount of foods, adding something is going to be a big reaction. So, but you can't change that quickly. You've got to change that slowly. And maybe first you are eliminating, you are simplifying, and you're doing a protocol. And then, later you're adding more, you're getting less restrictive. Constipation, I think, is it's definitely not impossible. It's a little tough because there's so many causes and you may have more than one. So just briefly, that vagal nerve that we talked about that goes from the brain to the bowels is important. It does a lot of important things. And there are some different techniques and even apps to teach you how to, I guess you could say, stimulate or regulate that vagus nerve. So that's one option to be looking into if you have constipation and possibly you have, trauma. Loose stool, I actually find to be a little easier to treat because it's usually from infections. So those can be treated with a combination of killing and also rebuilding the friendly ones. So here's those 4 products again that I really like, and some pictures of them and sort of how to utilize them. And, it could just be 3 months that you're using these. That's kind of a typical protocol. And you're adding different elements slowly, and you're rebuilding that gut. You're creating a better mucosal immune health and better bacterial profile. Some other supplement options are taking straight up stomach acid. And so I won't go deep into that, but I do have an ebook below this video that goes a little bit more into testing and kind of self-testing and seeing if a stomach acid supplement helps you. I personally love digestive enzymes. I think that they are just so great and they can help you have a more regular bowel movement, as well as just helping you break down food. And some people say, oh, well, isn't that like teaching my body to not work? No, your body is trying to work. And sometimes it's not doing a great job. And that may be from stress or from age or who knows what, from mold. But just adding in some fire to break down stuff is really helpful. Digestive bitters are a little similar-ish. They're from different herbs or orange peel. Some Chinese herbs can kind of fit in this category, but the bitter taste is stimulating to digestion in many ways. So you can eat a bitter salad or have like arugula, or you can have some greens that are bitter, like dandelion greens, or you can do these bitter tinctures that are in grocery stores. You can even make your own and have that right before a meal. Postbiotics are, we talked about, when you have friendly bacteria, they're breaking down and fermenting and making these postbiotics. And so I just thought I'd give them a mention as a supplement that you can potentially use. This tributane can be good for the brain, can be good for repopulating friendly bacteria. And then if you do want to do some killing protocols, a couple things could be oil of oregano or biocidin. That's like a mix of different herbals. And one more supplement option is binders. These things kind of structurally or chemically bind up waste in the intestines. This is our binder on the left. It was designed for mold, but it also binds with some other waste. And this one in particular helps for constipation. It has a couple herbs to help move bile and also move the bowels. So some binders will make you a little more constipated. So we decided to add some ingredients to keep things moving. Do not take this binder if you have loose stool. You won't like it at all. But if you are more constipated, you could take, a couple of these at night, and then you're getting some binding and some movement. So I think this is my last slide, and just wanted to say some other ways you can work with me. Here in Arizona, you can work with me in person. You may already be if you're on this webinar. I work also online to see people privately. But what we do a lot of is just education, and then we have a really robust supplement store. We're going to be adding a shop that has more detox products, things like red light and castor oil packs and air filters. We're going to be adding that soon. But we also offer testing that you can just put right in your shopping cart, and you can have your own stool test at home and see what infections you have. Or you can come talk to me first, and I can give you ideas on which labs to run. So my main site is just my name. It's bridgetdanner.com. And then this functional detox products is more of our supplement shop name. So, all right. I'm going to stop sharing. And if you have any questions, you are welcome. I don't see any questions yet. I had a really great time. I mean, it wasn't easy to put all that together, but I think it was really productive, because I think when you're having digestive issues, it just feels like such a mystery. You're like, I have no idea what's going on. And that's partly because there could be so many reasons why you're off. So hopefully this got you thinking about, oh, I could have that. I could have that. And then you can explore it and treat it. And that could be the end of your IBS. So it's not something you have to have for life. It's just something that developed, usually because of some changes and traumas and, infections that you experienced, and those can be reversed. So awesome. Well, thank you for being on and for your patience as I came in hot here to this presentation. I know this could be a little bit of a private topic too. So if you want to reach out, more privately, you're welcome to do that through the acupuncture clinic, which is linked below the video. We do offer a $50 getting to know you consult that you can apply towards a session if you want to move forward. So that could be a way to just, test the waters for you. And we have also a written guide that includes some of the information on this presentation, but some other information too. You can link that below. And if you want to rewatch this or send it to your daughter or friend, the YouTube link is the same. So the one you clicked on to watch this live is the same one you watched the recording on. So great. Well, thank you, everyone. I appreciate it. And I hope that I can support you if that sounds like the right fit for you. Thank you for learning about your digestive system with me. Bye, everybody.